Thank you. And Dr. Bashan, just so that you know, our rules say that Mr. Peters has to go first. So I call on Representative Peters for 5 minutes of
I love going
questioning.
in front of Larry. Thank you, Dr. Cohen. I have to say, we had a really great conversation the other day, and I was excited about, I think I was frustrated with a lot of people about CDC's communication, and I'm very indulgent because I know that, gosh, we didn't know anything. We didn't have any tools, and I thought that throughout the whole process, looking back, it would have been useful to share more of the uncertainty along with people as we went along. I think they would have appreciated that. And I think you just made a mistake in this testimony in that I wanted a clear answer to a question, do cloth masks work? And you gave me an answer as a lawyer that I had a hard time understanding. And I think it's a fair question. And I guess I wish that you had just said, don't use cloth masks, use the surgical masks. Don't we have enough information to answer the question like that?
Well, so I want to make sure that we are saying that cloth masks are a barrier, meaning that they do work in some, but do surgical masks work better? Absolutely, right? Would I wear a cloth mask? No, I wouldn't. I would wear a surgical mask.
It's still pretty complicated. My district is, I think, the 10th best educated congressional district in the country. My neighbor would say, should I wear a cloth mask? I don't know from your answer of what I should tell them. What I would say is, I don't know what to tell them. So I guess I'm a little bit frustrated with the still a little bit unclear response from you about a simple question. But let me ask about a complicated thing, which is data. What would you tell my neighbor about the importance of having good data at the federal level to help us inform how to prevent something like this from happening again, or how to address it as it happens?
Sure, but I want to be clear. Wear a surgical mask.
Yeah,
So wearing a well-fitting surgical mask. But on the data side, it is really important to have a national picture of what's going on. I think we've made a ton of progress in that way. I mentioned actually a new data visualization around our wastewater data. I think that is going to give us some really interesting look at some early signals about what's happening in communities all across the country. And the reason we need a national picture, I mentioned, I led the COVID response in North Carolina. Charlotte, one of our biggest cities, is on the border with South Carolina. It was really important for me as a public health official to understand what was happening in South Carolina to understand what would happen in Charlotte.
Back that up a couple steps. Why is that important? You say it's important. I think I agree with you. Why don't you explain why is it important for you to have information? And what information did you need to have to make a response?
Yeah, so having that information allows us to deploy different.
What information?
Depends on what we're talking about, whether it was how many people are vaccinated in an area, how many tests were we seeing people get access to. If I could see certain neighborhoods that weren't getting as much testing or as much vaccination, I could deploy at the state level different kinds of teams. We also had information, at the height of the pandemic where ventilator use was. And, that was an important point related to South Carolina, because there were multiple times where North Carolina had to share some of our ventilators with South Carolina. So knowing where our ventilators were and how we could be sharing resources was really critical.
So I've been long wondering what we could do in Congress to support better data at the national level. I know the administration has taken on a data monetization initiative. I think that's great. It needs to be funded. What is left to be done in that initiative, and what do you need from Congress in addition to funding?
Thank you for that. The funding is critical, and we want to make sure we're moving forward. But in terms of authorities, we have really scoped out something that I think allows us to do even a pilot is a step forward here. So we have some concrete language, and I'm happy to have our team share with you that we've been working on, particularly with some of our Senate partners, about how we can think about a data authority that allows for collection of data beyond COVID to make sure that we're getting the information we need to respond quickly, to your point, to deploy different kinds of tools based on what we see in the data.
Do you have legislative ideas for us that we need?
Absolutely.
Okay. Well, I'd love for you to share that with us. I think we all want to make this work better. I want to say again, look, we started this, we were really vulnerable as a country. We didn't have even PPE. We didn't have a lot of science. I think one of the ironies of this whole discussion is that one of the great achievements of the Trump administration was the warp speed creation of a vaccine really fast. They don't want to talk about it now because they're sort of anti-vaccine. It puts them in a tough spot, but I would like to know what lessons, positive lessons we can learn from that to make sure that we get these, that we're ready the next time. And I hope that you'll be very forthcoming about the funding needs you have, which will be smaller at the front end than they are in the middle. We lost a lot of, we spent a lot of resources dealing with this. I think that was the right thing to do in the circumstances, but let's make sure we're not caught unprepared next time and have to do that again. I yield back.